Diabetes is a 24/7 condition. It doesn't take a break, even when you're sleeping. In fact, the overnight hours can reveal a unique set of symptoms that every person with diabetes should be aware of. Recognizing these nighttime signs is crucial for effective management and getting the restful sleep you need. Let's take a closer look at 8 critical nocturnal symptoms of diabetes that you shouldn't ignore. Number 1. Nocturia. Nocturia is just a fancy word for having to pee frequently at night. It's very common, especially as we get older, but it's not just a normal part of aging. It can be a sign of underlying health issues, like diabetes. When your blood sugar is high, your body tries to flush out the excess sugar through urine. This means you're producing more pee even at night. Nocturia isn't just annoying. It can actually be dangerous, especially for older people. It increases the risk of falls and fractures when you're stumbling to the bathroom in the dark. It also leads to poor sleep quality, which nobody wants. A large study including over 179,000 subjects showed that diabetics are about 1.5 times more likely to experience nocturia compared to non-diabetics. So, if you're experiencing nocturia, don't just ignore it. It could be a sign that you are diabetic or your diabetes isn't well controlled. Number 2. Nocturnal hypoglycemia. Nighttime low blood sugar, also known as nocturnal hypoglycemia, is a common issue for people with diabetes, especially those who use insulin. Waking up with a pounding headache, damp sheets from sweating, or feeling more tired than usual could be signs you experienced a nocturnal hypo. This condition can occur for various reasons: taking too much insulin, being very active during the day, drinking alcohol, or skipping an evening snack. Parents of children with diabetes should also watch for clammy necks, as that can indicate a nighttime low blood sugar. Good news is, there are ways to prevent these overnight dips. Checking your blood sugar before bed, also having a bedtime snack, can help keep levels stable. If you notice a pattern of nighttime lows, work with your doctor to adjust your insulin doses. Being aware of the signs and managing your diabetes overnight will help you wake up feeling rested and avoid the dangers of undetected low blood sugar. Number 3. Dry mouth. Dry mouth, or xerostomia, is a common symptom experienced by many people with diabetes, especially those whose blood sugar levels are not well managed. Studies show that up to 62% of individuals with type 2 diabetes and over half of children and adolescents with type 1 diabetes report having a dry mouth. The reason for this is that high blood sugar levels can lead to excessive urination and dehydration, which can negatively impact saliva production. Additionally, diabetes can cause damage to the nerves that control the salivary glands, further reducing saliva flow. A dry mouth can be more than just an annoyance. It can make it difficult to speak, swallow, and even taste food properly. It also increases the risk of tooth decay and other oral health problems. There are some simple steps you can take to manage dry mouth. Work closely with your healthcare team to keep your blood sugar levels well controlled. Sipping water regularly throughout the day can help stimulate saliva flow and keep your mouth moist. Avoid tobacco products, as smoking can further dry out your mouth. Your doctor may recommend using an artificial saliva substitute, which can temporarily relieve dryness and make it easier to speak, eat, and swallow. These products come in the form of sprays, gels, or lozenges. If these basic measures don't provide enough relief, your doctor may prescribe pilocarpine pills. It helps stimulate saliva production from the salivary glands. Number 4. Sleep apnea. Diabetes and sleep apnea are more connected than you might think. If you have diabetes, you're actually at a much higher risk of developing sleep apnea. And it goes the other way too. Sleep apnea can increase your chances of getting diabetes. People with sleep apnea often experience gasping, choking, or snorting sounds during sleep, morning headaches, and feeling super tired and sluggish during the day, even after a full night's sleep. But how are they linked? Well, diabetes can affect the nerves that control your breathing, which can lead to sleep apnea. And the lack of oxygen that happens with sleep apnea can also make your insulin resistance and blood sugar control worse. Studies have shown that the more severe your sleep apnea is, the more likely you are to have diabetes. Plus, over 50% of people with diabetes also have sleep apnea. Lifestyle changes can help manage sleep apnea. Losing weight through a healthy diet and regular exercise can significantly reduce the severity of sleep apnea symptoms. A low-fat, low-sugar diet and physical activities like brisk walking or swimming can make a big difference. Avoidance of alcohol and sedative drugs which can relax the airway muscles are also recommended. Same as alcohol drinking, quitting smoking is crucial as the nicotine from smoking can induce changes in sleep architecture and relax the airway muscles. Sleep hygiene such as creating a sleep-friendly environment with a cool, dark and quiet bedroom is crucial. For more severe cases, individuals may find relief through the use of a CPAP device. Number 5. Restless leg syndrome. This neurological disorder can seriously disrupt sleep and impact overall well-being. People with RLS feel an overwhelming urge to move their legs, often accompanied by uncomfortable sensations like crawling, tingling, or burning. These symptoms typically get worse at night or when resting. For diabetics, RLS can be particularly troublesome. A recent study including over 800,000 participants suggested that about 1 in 4 people with diabetes experience symptoms of restless leg syndrome. It's more common in people with diabetes than in the general population, possibly due to nerve damage from high blood sugar. Treating RLS in diabetics usually involves managing blood sugar levels and using specific medications. Your doctor might also suggest lifestyle changes, like cutting back on caffeine or sticking to a regular sleep schedule. Number 6. Carpal tunnel syndrome. A comprehensive analysis with over 3.3 million participants found that diabetics are 90% more likely to get carpal tunnel syndrome than non-diabetics. The carpal tunnel is a passageway in your wrist that protects the median nerve and the tendons that flex your fingers. High blood sugar in diabetics can cause changes to the collagen in the connective tissue of the carpal tunnel. This makes the tunnel narrow and more likely to pinch the median nerve, developing the annoying symptoms of carpal tunnel syndrome. Well, you might experience burning, tingling, or numbness in your hand, especially in your thumb, index, and middle fingers. Some people describe a pain that shoots up their arm, and it can be uncomfortable enough to wake you up at night. If you're noticing these symptoms, especially if they're disrupting your sleep, it's time to chat with your doctor. Your doctor can diagnose this syndrome by asking about your symptoms and checking your hand for any muscle weakness or wasting away. They may also do some tests like an electromyography and nerve conduction studies to confirm it's carpal tunnel syndrome and not something else. Treatments can be simple, like wearing a wrist splint at night, changing how you work with your hands, or taking anti-inflammatory meds. Maintaining good blood sugar control is also crucial. In some cases, they might even suggest surgery. Number 7. Muscle cramps. Imagine suddenly feeling your leg muscles tighten up painfully. That's what we're dealing with here. For people with diabetes, these cramps can be a real pain, literally. They often happen in the legs and can really mess with your sleep. But why do they happen? Well, diabetes can disrupt the body's natural balance in several ways. It can affect your electrolyte levels, blood sugar regulation, and even impact your nerves and blood flow. While muscle cramps can happen to anyone, people with diabetes tend to experience them more frequently and severely. The exact reasons why diabetes and muscle cramps are so closely linked are not fully understood. However, a recent study found that about a third of people with diabetes get muscle cramps at least once a week. These cramps typically last a few minutes, and over half of the study participants described the pain as quite intense. The calf muscle was the most common location for these cramps. Nearly everyone in the study reported experiencing them there. Overall, the connection between diabetes and increased muscle cramping is something important for people with diabetes to be aware of and monitor. Number 8. Sleep disturbances. If you have diabetes and find yourself tossing and turning at night, waking up frequently, or feeling exhausted despite sleeping for long hours, it's time to pay attention. These sleep issues can be caused by various factors related to diabetes. High blood sugar levels may lead to frequent urination, disrupting your sleep. On the flip side, nocturnal hypoge can cause restlessness, nightmares, and night sweats. Diabetes-related complications like nerve pain, restless leg syndrome, and carpal tunnel syndrome all can also make it hard to get comfortable and fall asleep. Poor sleep quality isn't just annoying. It can create a vicious cycle. Lack of sleep can make it harder to control your blood sugar levels, which in turn can worsen your sleep problems. This can increase your risk of developing other health issues, also make managing your diabetes more challenging. If you're experiencing persistent sleep disturbances, It's crucial to talk to your doctor. They can help identify the underlying causes and suggest appropriate treatments, which might include adjusting your medication, improving sleep hygiene, or addressing any related health issues. Remember, getting good quality sleep is an essential part of managing your diabetes effectively. In short, recognizing these signs is essential for effective diabetes management. Doing so not only enhances your sleep quality, but also bolsters your overall control of diabetes. You might also want to watch this video to learn about critical eye signs of diabetes. This video helps you understand how diabetes actually affect eye lens, eye nerves, cornea, and retina.